But within this application, you can also go one step further, and especially with imaging. So here we switch to the cardiac MR part, where you can ask from the system to download the MR scan of our patient, so in our cardiac study. So as you did formerly through the patient browser, you just trigger an operation to download the corresponding records. And here you get the MR scan of the patient, onto which the application has superimposed or registered a 3D representation of the ventricles. So let me just take a more suitable visualization of this. Alright, so here you can see from the raw images the two ventricles displayed, left ventricle, right ventricle. And what's interesting in that model is that you get access to different parameters that are not obvious to obtain in clinical environment. So already the clinician using such an application could eventually make a decision regarding intervention based on the shapes and the evolution of the disease. But what's also interesting is that now that you have those measurements computerized, digitalized, you can look for similar patients now. So you, as you did for different clinical parameters in the former interface, you can now look for patients having similar shapes of the right ventricle, which is very interesting to have a look at what surgery they undergone, how they recovered, and so on. So here, if you click on the Find Similar Cases button, it's going to trigger, as it would do for a download operation, it's going to trigger a similarity search operation over the large database infrastructure. So if we quickly have a look at the notification frame, you see that the operation is ongoing. This one is a bit more computationally intensive, as this has to, as the application has to identify, locate patients having such records, for one. And then for each of these, it has to take the right ventricle meshes and basically compare the shapes. So it takes about a minute for 20 patients that we have with such records in the system. Once this is completed, you can, as you did for the former similarity searches, display the results using the different visualization techniques, so 3 maps. So here you see much less boxes because we have only 19 patients total having right ventricle meshes attached to their folder. You can also have access to the neighborhood graph and heat map. All right, so that is the first part of the demo where we saw how we can investigate the whole population at once using different clinical parameters, whether physical examinations, clinical variables, or imaging. And now we move on to another application, which is being developed by the INRIA, which goes beyond the 3D modeling with a complete model of the organ, complete heart model. So here on the left, this time, we are also connected to the HealthyChina infrastructure using a different operating system. Here we are under Linux, there we were under Vista. Similarly to Vista, I have an icon in the sys-tray, and I can, from there, I can access the application menu. Okay. So here we've started already. We've opened up the patient browser and opened up the patient folder that we are interested in. And we are going to ask for the cardiac simulation of that patient and open them with the Cardiology application from INRIA. So here the system is asking me what parameters of the model I want to get back from the database. So I'm going to ask for all of them. It downloads the data, starts the application, and from now on we can see the heart model personalized and superimposed onto the images of our patients. Let me just zoom in. So in that model, different features of the organ are illustrated. We have fibers orientation, anatomy of the heart, electric propagation, muscle contractility, and so on. So this is a complete model with anatomical, biomechanical, and electrical parameters. So from this application, we can then play with different features, to different possibilities to display the model itself, to remove certain features like to remove, for instance, the fiber vectors and so on. All right. But now, what's interesting with such a model, with such a full model of the organ, is that eventually, since you know the behavior of the organ, you can simulate it. So, in the context of right ventricle overload, what you could do is to eventually simulate surgery. So, if we open this anatomical model into yet another application from INRIA, which is called SOFA, you now can simulate your surgery. So, in other words, the model here displayed, you can go to the aneurysm here and start cutting. So if I do, let me do it from there. Okay, so here I can start simulating my surgery. And basically cutting let me zoom in. So you can start concretely cutting the aneurysm and so on. So you can do your surgery simulation, and since this is a model, you can then store your surgery, your new heart organ, and eventually, and that's what we are considering, discussing about within the project, eventually you could resimulate the new organ and check that the surgery was actually good for your patient, without, of course, touching the patient. So that's another view of what we can do in cardiology.